Hello, my name is Leon Menezes. I'm a consultant radiologist and a nuclear medicine physician at the Institute of Nuclear Medicine at UCL and here in the Barts Heart Centre. This series of talks from the British Nuclear Cardiology Society we've recorded is to give you the basic grounding in nuclear cardiology, the applications, the technology and the evidence. We hope you find them interesting and useful.
Hello, I'm Alex, a medical physicist in UCLH. This talk is on radiation protection. In this talk, we will cover what is radiation, dose and dose limits, good working practice, monitoring, regulations, and patient restrictions. Radiation is emission or transmission of energy in waves or particles. Types of radiation include alpha particles, beta particles such as positrons and electrons, and electromagnetic radiation such as microwaves and gamma rays. A radioactive isotope is one which emits radiation as it decays from a less stable to a more stable state. Radiation with enough energy to cause ionization is known as ionizing radiation. And we can see from the electromagnetic spectrum shown here that not all electromagnetic radiation is ionizing. For example, radio waves and microwaves are classed as non-ionizing radiation. On average, people in the UK are exposed to 2.7 millisieverts of ionizing radiation every year. The majority of this comes from natural sources, such as small amounts of radioactivity that exists naturally in building materials and radioactive gas which comes from the ground into all buildings. Other sources include food. You may have heard that bananas and Brazil nuts are slightly radioactive, and medical exposures such as CTs and X-rays. Radioactive material is one which emits radiation as it decays. The amount of radiation present decreases naturally over time. The time taken for the radioactivity to half is known as the half-life. The remaining activity decays exponentially, meaning that after 2 half-lives the activity is at a quarter of its original level, after 3 half-lives an eighth, and after 4 half-lives 1/16th. The half-life is specific to the isotope. For example, technetium-99m, the half-life is 6 hours. This compares to rubidium-82, which has a half-life of just 75 seconds. Ionizing radiation is a type of radiation which has enough energy to cause ionization events. This can lead to damage to tissue and DNA. Radiation protection helps to minimize the amount of radiation dose received and therefore reduce the risk from this DNA damage. There are 2 main groups of effects of radiation. The first is deterministic effects. These occur at very high doses and can include skin burns, cataracts, and acute radiation sickness. However, they all require a minimum threshold dose, which in most circumstances far exceeds anything seen in medical practice. The main deterministic effect which we see in medical practice is skin reactions or burns in patients undergoing radiotherapy procedures. The second type of effect of radiation is stochastic effects. In this case, the stochastic effect is cancer induction. The linear no-threshold model describes the relationship between radiation dose and cancer risk. So we can see from this plot that as dose increases, the risk of cancer induction also increases, and that there is no safe minimum dose. The slope of this graph is 5% per sievert. This equates to a 1 in 20,000 additional risk of fatal cancer from 1 millisievert of radiation exposure. This additional risk would not be detectable among normal background levels of cancer risk. There are a variety of dose descriptors which can be used to quantify doses of ionizing radiation. The most fundamental is the absorbed dose, which represents the concentration of energy deposited in the tissue and is measured in units of Gray or joules per kilo. If we take into account the relative effects of different types of radiation, we can calculate the equivalent dose, which is in units of sieverts. And if we then take into account the relative radiosensitivities of different organs or tissues, we can calculate the effective dose, which is in units of sieverts, and is normally described as an effective dose to the whole body. Effective dose is linked to risk from radiation. This slide shows a variety of effective doses from different sources. For example, a dental X-ray provides a very low radiation dose of 0.005 millisieverts, which is less than 100 grams of Brazil nuts. A transatlantic flight, meanwhile, exposes us to 0.08 millisieverts of radiation. This compares to the UK average annual radiation dose of 2.7 millisieverts. However, in some parts of the UK this is significantly higher, mainly due to the presence of radon gas. For example, the average annual dose to people in Cornwall is 7.8 millisieverts, and this is roughly comparable to the dose received by a CT, abdomen and pelvis exam. This compares to the annual dose limit for radiation workers of 20 millisieverts. The effective dose received by patients undergoing nuclear medicine exams depends on a large number of factors. These include the radiopharmaceutical, the physical half-life, the biological half-life, the distribution in the body, and the administered activity. You can see some examples here on screen. For example, the dose for rubidium-82 MPI study is 2.8 millisieverts. This is lower than many of the other exams, despite the very high administered activity of 2.2 gigabecquerels. This is mainly due to the very short half-life of rubidium-82. While there are no legal limits for radiation doses to patients, the ionizing radiations regulations stipulate limits for employees. There are different limits for different parts of the body. For example, the skin has a higher annual dose limit than the whole body. However, most workers are subject to a lower dose constraint, typically 3/10 of the annual dose limit. Any workers who may exceed this lower constraint become classified workers. A worker who is classified will undergo more extensive monitoring to ensure that the annual dose limits are not breached. Because the risk of cancer induction from ionizing radiation is directly linked to the amount of radiation received, we must try to keep the amount of radiation as low as reasonably practical. For the patient, this means keep doses as low as possible, but still high enough to provide diagnostic images. And for staff, this means using good working practice to keep the doses low while still being able to perform tasks efficiently. The core principles for reducing dose in the work environment are time, distance, and shielding. For time, the dose is proportional to the time spent in contact with the radiation. Therefore, by halving the time we spend in contact with the radiation, we can halve our dose. For distance, we must keep as far away as possible from a source of radiation. If we can double our distance from the radiation source, in general, we can reduce our dose by a factor of 4. This follows the inverse square law. And for shielding, if we can place a material between us and the radiation source which effectively absorbs the radiation, then we can protect ourselves from the radiation. The amount of protection depends on the radiation type and the type of shielding used. Here we can see some examples of shielding used in a standard nuclear medicine department. On the left and in the centre are different views of a syringe shield. These are used for drawing up and injecting patients. We can see that they have lead glass windows to allow the operator to see the volume remaining in the syringe. On the right we can see an example of an area used for drawing up PET doses. For gamma emitters, shielding is normally made out of lead or tungsten. whereas for beta emitters, shielding is normally made out of perspex. This is because perspex is sufficient to absorb beta radiation and does not produce secondary radiation. One of the key hazards when working with unsealed radioactive sources is the potential for contamination or radioactivity to spread onto different surfaces, including the skin. To protect us from this, we can wear gloves when working with unsealed radioactive substances and appropriate clothing such as uniforms and disposable aprons. We can also use trays and absorbent materials in any areas where there are risks of spills to make sure that if a spill does occur, it is contained. If a spill occurs, you must only deal with the spill if you've been trained and you feel competent to do so. You must contain the spill to prevent it from spreading and ask for assistance from trained colleagues. It's important that you know where the spill kits are within your department, as these contain equipment essential for dealing with spills. To avoid internal contamination, that is, ingestion of radioactive substances, you must not eat, drink, smoke, or apply cosmetics without monitoring hands first, and you must wear personal protective equipment as provided and cover any cuts or breaks in skin with plasters. All controlled areas within the nuclear medicine department have associated local rules. These local rules contain instructions on how to operate safely in that specific area, and they must be followed by all workers entering the area. These may be backed up by additional SOPs, such as how to perform personal environmental contamination monitoring and how to manage radioactive waste. The main aim of these documents is to ensure that staff are working in a safe environment and that regulations are complied with. The local rules will state whether any personal dose monitoring is required for certain staff. The most common form of personal dose monitoring is the whole body dosimeter, an example of which is shown here. This can be worn anywhere on the main trunk of the torso and is read once a month, typically around once a month. You may also be issued with radiation monitors for extremities, such as fingers. Some examples are shown here. These are generally worn when preparing, dispensing and administering doses, and again typically read out once a month. Certain staff may also be issued with real-time personal dosimeters, which measure the amount of dose received instantaneously. Because radioactive contamination is possible on a range of surfaces, we should use specialised contamination monitors to detect this. This includes using monitors for personal contamination, for example on our hands or our feet, whenever we suspect there's contamination or when leaving a controlled area. Performing environmental monitoring with contamination monitors, and monitoring waste which may be radioactive. The Ionizing Radiations Regulations 2017 regulate on the exposure of staff and the public arising from work with ionizing radiation. Key aspects of these regulations include implementation of dose limits, requirements to perform risk assessments prior to starting any new or changed work, and implementing the finding of these risk assessments where necessary into the local rules, and providing contingency plans in the event of unexpected occurrences. The employer is advised by the Radiation Protection Advisor on how to comply with IRR 17, and locally, compliance with the local rules is supervised by the Radiation Protection Supervisors. The Ionizing Radiation Medical Exposure Regulations, also known as IRMA, primarily govern the rules regarding irradiation of patients, in addition to a couple of other classes of people, such as research patients and comforters and carers. The regulations are there to ensure that the use of radioactivity is justified and kept as low as reasonably practical. They stipulate the use of diagnostic reference levels to aid with this. employers must also put in place employers' procedures on how to deal with medical exposures. This includes correctly identifying the patient, identifying pregnancy, procedures in the event of unintended exposures, and other similar procedures. Also outlines the responsibilities of duty holders. The duty holders include the employer, who is required to provide employers' procedures, training records, and audits, the referrer, who refers for an individual medical exposure, and they're required to provide all information essential for the exam to be justified. The practitioner takes responsibility for the individual exposure and justifies the request, and the operator carries out practical aspects of the exposure. Also requires both employers and practitioners to hold a licence for the administration of radioactive substances. These are colloquially known as RSAC licences, as RSAC provides advice on issuing such licences. The environmental permitting regulations govern the holding, use, and disposal of radioactive materials from a given site. This includes open sources, sealed sources, and waste. Duty holders under the Environmental Permitting Regulations, or EPR, include the EPR competent person and the radioactive waste advisor. They require that we employ the best techniques we have available to limit the impact on the environment from our work with radioactive materials. Because we administer radioactive substances to patients, the patients themselves may become a source of radiation. In order to ensure that the general public who come into contact with the patient remain safe, it may be necessary to supply some restrictions to the patient. In particular, restrictions may be imposed for patients who are likely to come in contact with young children or pregnant women. For example, in UCLH, we advise that there is no contact with young children or pregnant women for 6 hours following 800 megabecquerels of MIBI injection. And this is primarily to ensure that the dose to the general public, as well as vulnerable groups, is less than the legal dose limit. In addition, any ladies who may be breastfeeding may require additional restrictions, such as intervals of interruption to breastfeeding and expressing breast milk prior to exams. Further information on this can be found in the RSAC guidance notes or from your local physicist. In terms of risk to staff, particular attention is normally paid to staff groups particularly at risk, and those include pregnant workers or breastfeeding workers. At UCLH, we ask all pregnant or breastfeeding workers to inform the RPS so that we can carry out individual risk assessments to ensure that the safety of the fetus or baby is maintained and that a dose limit of 1 millisievert per year is adhered to. This may involve reallocation of tasks for the term of the pregnancy or for the duration of breastfeeding. To summarise, dose limits are in place as required by law to maintain safety of staff and public. It's necessary to read the local rules and employers' procedures to ensure that you can maintain the safety of yourself, your patients, and your colleagues. At all times, comply with as low as reasonably practical to reduce the dose of radiation and therefore reduce the risk of cancer induction. Practice time, distance, and shielding to reduce radiation dose at all times. Use sensitive radiation monitors, both for personal monitoring and for monitoring of contamination. And if you're unsure about anything, talk to your local RPS or physics team.
Please comment below if you have any questions. If you found that interesting, please like and subscribe for more lectures. If you'd like to know more, follow the BNCS on Twitter and visit our website. Thank you.